of Kilifi.
All right, let's get back to Kakamega County, where the county government is set to launch a health services fund, which has been tipped to be a game changer in the healthcare financing in the spirit of universal health coverage. Alan Ochanda now joins us live with more. Good morning to you, Alan. Over to you.
Well, good morning to you, Purity, from Kakamega here. And of course, remember that health is a devolved service, or rather devolved role. And so in the counties we've seen it's actually been limping. But to actually address that, we've seen the Kakamega County, of course, specifically the health department, now coming up with an ingenious that, and so they are launching that health services fund, which they say is actually tipping to address the different problems like, of course, availability of non-pharmaceuticals and health services generally in the health facilities within Kakamega County, and to ensure that there's actually prudent management of the funds that are being generated from the health facilities. But let's just talk to some of the officials who actually made this a success. Karibu sana bwana chief officer here, David Alila. Maybe just tell us, just explain to us what this special fund really means to the residents of Kakamega here and how it's actually been tipped to be a game changer.
Okay. Thank you. Thank you. My name is Dr. David Alila. I'm the Chief Officer, Medical Services, Kakamega County. Tomorrow is a big day for us. We are launching the Kakamega Health Facility Fund, which will be a game changer in the health sector. Ideally, in this fund, the facilities will collect revenue, and they'll spend that particular revenue at source within a prescribed time, because what we have in our bill is that they collect funds, then after 3 months, we spend that particular the money in those particular facility without transferring the money to CRF, the County Revenue Fund.
Maybe how was it before you actually came up with this particular law to ensure that it's actually anchored in maybe the law enacted by the County Assembly? How was it being managed?
Before then, facilities used to collect revenue. After collecting revenue, they were swiped to the County Revenue Fund. After swiping revenue, swiping into County Revenue Fund, it is they were to request again so that they are given this particular money to spend. I read that most counties have a lot of expenditure needs, and by then, at times this money is not spent particularly on health.
Maybe specifically, of course, in the counties we have level 1, level 2 to level 5 hospitals, and of course here in Kakamega you're actually privileged to maybe in the near future be having level 6 hospital. Will this law, from which level will this law be affected? Maybe from level 2, level 3, and maybe in the past you talked of the fund really going to other roles, and from which level will the monies be collected from?
Okay, according to the money is collected from level 4 facilities. That's ideally where we collect money up to level 5. But also level 3, 2, and 1 depend on the county to facilitate them financially. Of course, we have other donors who are funding the same. But once this money has been collected, it's budgeted for by those particular facilities. Then in the budgeting, we also consider level 3, 2, and 1. So it will also be able to facilitate those particular facilities. Yeah.
Is it maybe a pilot program, or rather, this is actually the first county to have such a program? Do we maybe expect that the other departments, of course, that the other ministries or other departments at the level of the county will also be coming up with similar funds in their respective, of course, ministries to ensure that they actually streamline the service delivery to the wananchi of Kakamega?
Well, this specifically for health, I think there are counties that have tried, but for Kakamega, we went through the due process. We came up with a bill. It went to the county assembly. It went to the COB for ratification, control budget. Then we are launching it officially. And we read that in Kakamega, the cabinet, His Excellency, the governor, has actually supported this particular idea, 100%. that through his chairmanship in the cabinet, he was able to ratify that and approve that the facilities should retain 100% of their collection without going away. So that's how it is unique in Kakamega, and it's going to be a big thing for us. Yeah.
Thanks so much. Well, I understand you also have your officers here, but because of time, my director is just whispering that time is limited, but we shall be catching up with him at 11 for the Swahili Bulletin to just expound further and, of course, wider on that particular special fund that is actually geared towards ensuring that these streamlined services, of course, specifically health services in this particular county of Kakamega, but, of course, it's actually been ring-fenced in law. It's actually enacted, and, of course, by the County Assembly of Kakamega here. And so, really, changer here, and of course first of a kind, the first one among the 47 counties here. And so Purity, we shall also still be talking about this particular topic at around 11, and of course in our subsequent bulletins, just availing ourselves, of course, tomorrow when they will be really launching this particular fund here, and we're expecting the CS for Health